Hi, I'm Dr. Angeli Akey.
And I'm Dr. Kathleen O'Neil-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello, everyone. Welcome back to the FIRRIMup Doctors webinar. My name is Audrey, and today we're going to have our fifth and final episode from the COVID series. Today is all about post-acute COVID syndrome. So this is just a big word for what happens after COVID, that initial COVID phase. So that today the doctors are going to walk us through some tips and some guidance on how to heal our bodies after COVID. It's going to be a great episode, and we're so happy that you joined us today. So I'll pass it on to our FIRRIMup doctors, Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith. We're all good to go.
Hi, everybody. Thank you for coming. This is the last in our series of the COVID series from the FIRRIMup Doctors. Hi, Dr. Kathleen. How are you?
Hey, happy Thursday.
Yeah, happy Thursday, everybody. So today we're going to be talking about, we started with prevention, then we talked about post-exposure prophylaxis, then we talked about treatment and management of acute illness, and now we're going to talk about cleaning up the castle after the damage has happened, or post-acute COVID syndrome, also known as post-COVID syndrome, also known as long hauler syndrome by the general public. And this is really interesting. It's one of those disease diagnoses that's being developed in real times that's actually been pushed by the general public, because right off the bat, as early as the spring and summer of last year, there were Facebook pages that were growing and growing for support groups for people who didn't feel well after acute COVID. And it was only after then that the medical community started looking at it, and the journal, the American Medical Association, published an article on long haulers or post-acute COVID syndrome back in the fall. And basically, it's a constellation of symptoms that is currently being defined. It usually is defined if you've been not well over 10 to 12 weeks after acute COVID, where you can have a constellation of problems still. Brain fog, sleep disturbance, anxiety or depression. You got some weird chest pains, even with normal echocardiograms and normal EKGs, inability to exercise, and muscle aches and pains all over your body, just like we've seen with fibromyalgia or myofascial pain. So yeah, so that's what we have defined now as post-acute COVID syndrome. So next slide. So when we talked about, keep going. So it's the NIH actually put together a study group December 8th through the 11th of last year to really kind of get the brains together of the world to really understand post-acute COVID syndrome. And the closest previous diagnoses that they related it to was something called chronic fatigue syndrome. And so that's what we're thinking in terms of what's happening to the body, but we're going to spend a little bit of time talking about it because every single day, Dr. Kathleen and I are trying to manage this. So much so that we actually put our brains together and we're helping to design a clinical trial to help people get better. Right, Dr. Kathleen?
Yeah, it's really exciting actually to be able to do this. And I think that the other thing I want to say about the post-COVID syndrome is that it doesn't have to be something that's continuous. So it's not like every day you have to have the same set of symptoms, 3 or more, or anything like that. You could have these symptoms intermittently throughout the week, and you don't have to have all of them in the same day. Because I see a lot of patients who definitely have post-COVID, and something may just cause their heart to just start really racing for no good reason. They could be lying down, they could be sitting down, they might start sweating, they might have muscle pain. So a lot of these symptoms now, after people have had COVID, just are showing up because the systems are confused. I mean, it's basically what Dr. Akey and I talk about with immune confusion. So it's really important that we take time to understand this, because it's going to be a really big component of our medical system and costs within our medical system if we don't pay attention to this.
Yes, and because the syndrome is still being defined, you'll find studies, and we'll go over a couple clinical studies that, the range of the incidence is 10%, in some cases up to 80%. But I would say, and in my own personal practice here in Gainesville, at least half of people have some fallout after getting past the acute phase of COVID, and we're trying to get them better. Actually, we'll talk about the ways that Dr. Kathleen and I have made up in our patient populations getting so much better that I was telling the trial group that we're involved with that we might not have very many patients to enroll because our patients are actually getting better.
Yeah. Well, we can find patients. I'm sure that we can find patients to enroll. So
yeah, I see it. I see a few volunteers in the chat, friends of friends. So, okay, next slide. Before we go any further, we decided to take a step back, and we promised to be with you through this public health emergency, but we're going to actually change the format a little bit. We're actually going to continue the webinars, but just on the second Thursday of the month at the same time. So the next time we'll meet will be March 11th in this format. Meanwhile, we're going to take a step back and design a podcast series. We're trying to have a broader reach for our ideas and thoughts. So if you have ideas and integrative health topics, please email them in to FIRRIMupDoctors@gmail.com.
Well, one of the reasons that this is important is because we love you all, and we appreciate and thank you all for being here with us and for helping and guide us. But we definitely want to reach a bigger crowd. So in order to reach a bigger crowd, we would love to know from you what we can do better. And again, topics that you're interested in. It doesn't have to be COVID. We'd love to be able to educate the general population, not necessarily with major details from like a journal club of the New England Journal of Medicine, but certainly with how to think about a problem that they may be experiencing, a set of symptoms, a diagnosis that they may have received. And we want to help people understand how can they get to the root cause of that. This is our passion. This is what we do every day. And we want to definitely bring the everyday public into the knowledge base of how do they evaluate the problem to get to the root cause, because we think that that's going to make a big difference in your lives and in the lives of any of our listeners.
Yeah, so we're going to continue these conversations in this format again the second Thursday of the month at the same time until this PHE public health emergency is over. But we do hope that once we launch a podcast, you can continue to spread the word about what you're learning with us.
Mm-hmm.
So go ahead, Dr. Kathleen.
Yep. No, if your castle's been breached and COVID has infected you, then it is possible, obviously, that you will end up with COVID acute infection. And the goal for our treatment and wellness protocols is to prevent that from happening. And we've talked about that over the last few months and how to restore your castle. But it's really important that we start right now so that we can prevent this PACS, P-A-C-S, post-acute COVID syndrome. Not a fun syndrome to have, and a lot harder to treat because it's a different protocol than the acute infection. It's immune confusion.
So we'll share with you one slide and we'll talk about our ideas and what we understand as to why this happens. This was published, a clinical series from the British Medical Journal, a reputable journal, and it looked at 277 people who recovered from symptomatic SARS-CoV-2 infection. And about 220 were severe or non-severe hospitalized at home, and about 54 were mild. And they looked at people with an average of 77 days after, so about 10 weeks after. And they found that post-acute COVID syndrome was present in about half of the people. And I think that when they looked at the signs and symptoms, they certainly match what we're seeing in our clinical practice, or at least what we're seeing here in Gainesville. About a third have persistent fatigue and shortness of breath. That's what dyspnea means. About 1 in 5 people still can't smell. About 1 in 5 have this chronic cough, headache, about the same. And so basically they're just not feeling well. In my current clinical practice, I have about 3 people out currently for modified work or complete rest with Family Medical Leave Act from post-acute COVID syndrome. When you look at the chest x-rays, only about 19% have abnormalities still. And standard breathing tests, which we offer in our office, spirometry, show about 9% have abnormalities in breathing tests. But yet even with the normal breathing tests, people still complain they're short of breath, Dr. Kathleen.
Yeah, well, it's the same thing with COVID when you're in the ICU. You know, people, the lung situation that happens is not your typical ARDS until way at the end of the process. So we really need to be understanding a little bit more about how these things work. But I have many patients who have cardiac symptoms as well. And there is nothing on their EKG, their echocardiogram, or any of the testing that we've done. So that suggests to me, with those level of symptoms, probably 4 that I can think of off the top of my head in my practice, that there's something innervating through this. So there's immune confusion, and then there ends up being an innervation of the heart through the nervous system that is trying to respond to that confusion. And the heart starts beating really fast, really rapidly, and makes people feel uncomfortable and gives them the feeling of dyspnea or shortness of breath. There may be, some that do have residual abnormalities within the lung, but we definitely know that this fight or flight reaction could also be neurochemical due to immune confusion. So we want to keep a broad level of awareness about what the combinations are, not just the individual abnormalities within the bloodstream or within the neurochemicals that could be happening, because one problem will also create another problem. So we definitely want to be aware of that. But it's really troubling to think about how broad this is.
So, Dr. Kathleen loves to talk about the 5,000-foot view and the 50,000-foot view. So you remember when we talked way back at the beginning, go back to the other slide, that when you inhale the virus, and this is not the SARS-CoV-2, but it's just an analogy in a bacterium, that when you inhale the virus or the infection, you actually have your cells, the lock and the key, next slide, Audrey, is that you actually see the key is the spike protein, and the receptor is the ACE2 receptor. So it goes in your cells, your mucosa or your lungs, or it can go in the vasculature, it could go in the heart, it could go in the kidneys. And so at a cellular level, there's a lot of inflammation. It goes in the brain, especially through the olfactory nerve. And so you're seeing a lot of inflammation. And if you continue to have, the thought is if you continue to have viral protein hanging around, you'll continue to have immune stimulation. Mm-hmm. Mm-hmm. Do you want to talk about the systemic effects? So that's over on the left, and then on the right, Dr. Kathleen.
On the right, and so when we talk about an organ, we talk about the brain, we talk about the lungs, we talk about the muscles. Every organ is made of cells. So any or all of the cells within an organ system, lung, brain, muscles, can be infected by these bugs. So it's really important everybody will have their own organ system infected. I never really had a lung issue when I was infected with COVID. So that was a big relief to me. So that never became a residual issue, never had shortness of breath, definitely had cardiac, definitely had muscle. And so the cells that got infected by the virus for me are cardiac and muscle cells. It doesn't mean the heart, it means the cells of the heart. And I don't really have a lot of residuals from that perspective. The residual I have several months out is really more in the central nervous system or the brain, that I likely think is not the bug. I think it's the immune confusion that the bug will affect. So the symptoms I have could be word finding difficulty is the one thing I have more than anything, that I'm not used to having as much word word finding difficulty as I do now. Maybe I used to have a little bit, but nothing like I have now. So I think that's a residual based on particular white blood cells or different types of cells in my central nervous system in the brain that it's not that they continue to be infected. That doesn't seem to be the issue. It seems more to be an immune system response under a stressful condition. So I think that immune confusion speaks to that. Any other thoughts on that?
Yeah, that reminds me of this case series that was published on December 28th in the New England Journal of Medicine about half a dozen Chinese people that died. Average age was 56. They died of COVID, and then they did autopsies of their brains, and they couldn't find any virus. What they found was a lot of inflammation, and that the vasculature had been breached, that basically they had leaky brain and a lot of inflammation. And so I do believe that's a lot of the brain fog and the confusion. And in Gainesville, my patients are responding to intranasal glutathione, which you suggested, in terms of the brain fog and the confusion, trying to decrease the inflammation and heal the leaky blood-brain barrier.
When the blood-brain barrier is leaky and the virus gets into the cells, and then there's some cleanup that has to happen called autophagy, which was spoken about before. Autophagy, self-phagy is cleaning up, chewing up things and getting rid of them. So we don't really do a lot of autophagy when people come home from the hospital or even people at home. We want to basically be saying, okay, let us help you clean this up. We know that glutathione is a master of detoxification in the body. So if we add glutathione and we can inhale it and get it through into the brain, the central nervous system, then it's going to help with this autophagy or this housekeeping to clean up anything residual in terms of inflammation in the brain. So it's a really great therapy. And you can measure the levels and you can see what people need, but nonetheless, you could just use it to treat as well. Pretty harmless. We use a glutathione derivative when people have Tylenol toxicity. So one of the derivatives in the emergency room, if someone had a Tylenol toxicity, which is relatively common during allergy season, and a lot of people show up at the ER with this, we use NAC or Mucomyst, which is similar to glutathione. It's in the same family. So this is not a foreign thing in the conventional world.
Good point. And then just before we leave this slide, there's a prominent gut here. And I just want to mention that a lot of my patients have irritable bowel type symptoms after COVID, because there are ACE receptors along the gut. And actually with acute COVID, y'all might remember that nausea, vomiting, diarrhea presents even by itself with acute COVID about 4% and 5% respectively. So cleaning up the gut, making sure the microbiome is healthy is really important in getting someone back to their homeostasis. This was a big article just published 3 or 4 weeks ago from the Lancet. That's a major article. And it looked at 1,733 people in China. And they basically were looking at post-acute COVID syndrome. Next slide. The reference is at the bottom if you want to actually read this whole article. Next slide. But the conclusion was that 6 months after symptom onset, go back one, Audrey, there was fatigue or muscle weakness 63% of the time. And certainly we're seeing that. We're seeing people are just tired, or they're like, Doctor, I can't exercise. I had COVID 2 months ago. I'm like, okay, we'll try to get more rest and sleep as much as possible. And I actually convinced someone to get the Oura ring. We've talked about the Oura ring because it'll tell you if you're ready or not ready to exercise. In this study, 1 in 4 people had sleep disturbance, and about the same amount had anxiety or depression. And those 3 things, sleep difficulties, anxiety or depression, that's messed up blood-brain barrier. That's a brain trying to heal. And there's this new field of medicine called chronobiology, where it talks about circadian rhythms. And it's really interesting that if you just think in your own history that a lot of times illness presents with a disruption in your normal circadian rhythm. First presentation of autoimmune, first presentation of cancer, et cetera. But in cleaning up people post-COVID, that's an easy question to ask. Are you sleeping? Is your circadian rhythm now messed up after COVID? So very prominent in this study, big study, 6 months after, 1 in 4 people still weren't sleeping right or had anxiety or depression.
It's really important to think about. Yeah, because I received an email today from two patients who are freshmen in college. They're twins, and they are at home, and they were diagnosed with COVID about a week ago. And their parents are quite worried because they're saying they still have fatigue, they still have muscle weakness, they still have a little bit of pain. And I said, nope, this is part of a course. I'm not going to go there and say, oh, in 6 months you could still have the same thing. But at this point in time, 7 days out, it's pretty likely that you're still going to have these symptoms and sleep difficulties, of course, because you can't do a lot all day long. So sleeping, with this chronobiology is, in terms of when you can get your best sleep is going to be really challenging. And is for the vast majority of the people I know who have had COVID in my practice.
And kind of reminds me in my clinical practice of the young adults or the older teens that have had mono and post-mono fatigue. Like I remember taking people out for a whole semester to recover from their mono. This is also a viral illness. We're just trying to discover it now. We're just trying to uncover what the course will be for most people. So there's a few little clues here. But there are some interventions that we've been successful at helping our patients get better. Next slide. So let's talk about what we've been doing in our own practices to help repair your castle, so to speak. Rest as long as your body needs. Don't overtrain for sure. It's not the time to be training for sport if you've just recovered from COVID. Today I had somebody who had full-blown COVID 6 weeks ago. I had to put her on FMLA completely for a month. About 2 weeks ago, I put her on work restriction at 20 hours. I started IV nutritional therapy there, and she's doing so well. Today she asked me to go to 20 hours a week, a restriction instead of 30 hours per week restriction. And because her brain's still foggy, I added intranasal glutathione. I've had her on phosphatidylcholine and a high dose omega-3s the whole time, as well as our usual CDAWs plus protocol. So she's happy, she's progressing quite well, but I was concerned that she wasn't progressing as fast as I thought she should. But as soon as I added the IV nutritional therapy, it was a game changer for her. She did not have a lot of muscle aches and pains. Normally when you do, I'll refer you to Marlene, our Chinese medicine doctor, to work on the fascia, but it's really important. The fascia is so important. And I'd have you go back to our recordings from late fall on the FIRRIMup Doctors webinar to really hear about the importance of fascia.
It's amazing. I think that the first one, people really have a hard time with resting, and we all want to get back to whatever we're doing. And I can think of almost every patient that I've taken care of with COVID who, keeps asking, when is this going to be over? When I need to work. I can't, fall behind on my work or my school or anything like that. And I think it's really, really important. If we don't rest, just like if we don't fortify our immune system, it's going to have a toll. That's part of the problem. And I think, I'm happy to help people and write letters, as you are, Dr. Akey, to be sure that people get adequate rest, because the price you'll pay later, an ounce of prevention is a pound of cure. So rest is really, really important. And I know for these twins that are here now with their parents, they need to rest more. It's not that they're out with their friends, but they're, in hardcore schools. They're very good students, and they're trying to keep up with everything. I honestly think that a little bit of rest will go a very long way. It's very, very important. I also went over there and gave some IV nutritional therapy to their home this week, and they felt dramatically better. But then within 2 days, they fell back to their symptomatology. And I think it really has to do with they're doing other supplementation as well, as you see here. But resting is really key. We can't underestimate rest.
Especially that deep restorative sleep at night. So important to reboot and heal your body.
And melatonin is a very, very good aid for that, a slow release melatonin.
Good point. Good to remind everyone about the melatonin. So please remember your basic immune fortification, whether or not you've had a vaccine, going into a vaccine, have had COVID or preventing COVID. These are just basic protocol. Remember, you tell your friends and family the CDAWs plus protocol. So CDAWs, C, D, omega-3 fatty acids, and zinc on the top line. The plus is quercetin, stabilizes the mast cells, inflammation. We like colloidal silver to protect you in your nares, and then also to increase your nitric oxide, that's Neo40. We pulled a couple fast ones on you. We talked about phosphatidylcholine in repair post-PAX, and that's a really good one to repair the nerves as after a post-acute COVID syndrome. Again, it's phosphatidylcholine.
And if you eat eggs, the yellow of the eggs contains the choline. So a little bit of egg yolk per day, if you can tolerate it, it's not a bad thing.
Absolutely. Next slide. So let's go through the updates. Slowing down in North Central Florida, and I hear around the country. So in Florida, 20 million tests, 29,300 deaths in Alachua County, 22,000 confirmed. Now, again, there's no different, they don't differentiate positive tests from illness. And this crowd knows the difference, right? So if you've had a positive test plus symptoms, that equals illness. But a positive test is just a positive test if you have no symptoms. So we've had over 200 deaths in Alachua County. We've had one more death in our practice, 75 years old, also a woman. So 4 women, everybody was over 75. And actually, so that number must be 6, 4 women and 2 men, older.
I'm sorry.
So but we've managed a lot of sick COVID patients, over 100 now. And a lot of accidental exposure still. So please continue to keep your guard up, wear your masks, etc. And remember, if you've been vaccinated, you're protected 94.5% of the time, but you could still carry and transmit. So still be cautious.
It's very important to understand. Well, I have a very different kind of practice than Dr. Akey, and we have not had any deaths. I would be surprised if I did. That would be very unfortunate because I have a younger practice. And in Boston or in Massachusetts, we are not considered to be doing well at all. And I think, we're indoors, it's winter. I'm not really sure what the issues are, but I think that we just have to stay on it, That's all I can say. And I don't think we're doing a great job vaccinating either. Apparently, this is what I hear and this is what I read, but I don't really know the details of what's happening specifically with the governor and the state.
So next slide. So in the vaccine tracker, it looks like Florida is at 5.5% fully vaccinated, and Massachusetts about 4%.
Mm-hmm. That sounds about
Next
right.
slide. We'd invite you to look at the VAERS vaccine adverse event reporting system. To date, there's been 116,678 adverse reactions. Over 25 million vaccines have been administered. We think they're underreporting at the website. Most people say it's really hard to, it's not a user-friendly website at all. Next slide. So we're going to go right to the Q&A. And so we could wrap it up, and then we'll plan on seeing you all again on March 11th. It's a Thursday. Dr. Kathleen, why are some people more likely to have PAX than others?
Well, I think there are lots of reasons, but it does depend upon your comorbidities. It does depend upon how fortified your castle is from an immune system perspective. There may be other hidden things that you may not realize, especially if you're young, that you have genetically, like a predisposition to clotting, or there may be people who have RAS receptors, these angiotensin receptors. They may have more of them based on genetics as well. So I think the one thing that you can definitely do is fortify your immune system. The other thing with PAX that I think we're doing well is we're basically on the front line, understanding that we need to treat people from day one. We need to do prevention with immune fortification. We need to do prophylaxis, and we need to do some type of a treatment when people get sick. And many people aren't. I would say the vast majority aren't doing any of those 3. And as a result, I think that those will be more likely to be the people who have PAX. I think also you and I know if people have clotting diatheses, as you do as well, Dr. Akey. So I think there's a lot of information that we can glean while people are well, that we can use to help them with our treatment protocols to prevent them from getting a PAX syndrome.
Yes, and don't forget that it looks like in the early clinical studies, it looks like the sicker you are with your acute COVID, the more likely you're going to have post-acute COVID symptoms. Remember to decrease the viral load. Try not to re-inoculate yourself if you have acute COVID, i.e. keep your nares clean, keep the windows open, keep the air moving. And by fortifying your immune system at the front end, you won't let as much viral load into your system to begin with.
And that Argentine silver nose spray. Dr. Akey, can your body's ability to heal remain the same as you age?
Well, it depends on how your individual capsule is, your genetics, your environment, whether or not you smoke. But in general, as we age, we end up towards entropy, all thanks to disorder. But through doing the things that we talked about, intermittent fasting, exercising, getting a good body weight and not being obese, and taking your CDAWs plus protocol, getting a lot of sleep, you can actually help your immune system and help your healing ability in your body to stay well and healthy. So there are things you can modify to help yourself heal and to prevent a full-blown attack or full-blown infection of COVID.
Your body's biological age does not have to be the same as your body's chronological age. So you may be 50, but you could have been really healthy and have kind of the body of a 45-year-old. So you can do that mostly by lifestyle. That's 50% lifestyle. So it's you need to sleep, eat, move, think, breathe, blue zone, right? Blue zone diets and good relationships and things like that, and work on your inner knowledge and your spiritual side. And then the minority of the percentage will be learning. Do you need extra vitamin D for your immune system? Do you need omega-3s? What other things is your body lacking that you can just boost? And the more that you understand and you target the boosting within your own system, the more you can pull your biological age down from your chronological age.
Good point. And just remember about being well and homeostasis or balance is about taking away things that are harmful to you and giving your body things that it needs. And that's what a guide like Dr. Kathleen and I, as your physicians, we can help you with that in identifying that.
For sure.
Is the damage caused by PACs reversible, Dr. Kathleen?
Well, I'm a believer that we can help anything. So no matter what, I'm always a yes person. Let's go, let's do this, let's come up with a plan. So I love to be a detective and I never say never. So I think that the damage can be reversible. Can it be cured is maybe a question that I would say. I never guarantee cure because I don't think that I am all powerful, but I definitely believe that I can always pull back. And so when I think of illness that starts with an I, and then I think of wellness that starts with a we, W-E, I'm always thinking that as a physician, the patient and I are pulling back towards wellness, always. And if we work as a team, we can always win. How big is the win? I'm not sure, but I believe it will be a win and we will be able to reverse some of the damage.
And I think this particular illness or disease state of PACs actually hones in on what we've been messaging for 3 years. We've been working together, Dr. Kathleen, is that it boils down to fire or inflammation, rust or oxidative stress, and then immune dysregulation. So when we're trying to uncover chronic hard conditions such as PACs, we're always going to the basics and trying to figure out for you which one of those 3 realms we need to work on and chip away at it as part of your team.
Well, the alternative is doing nothing. And if you do nothing, you're definitely not going to reverse anything and you're not going to get better. So I believe that doing something and even a little bit of something will make a very big difference if you do a little bit of something every day.
So yeah, thank you all for being with us. It's been a year already, just about a year, and we're not going anywhere. We're just going to evolve into launching a podcast. So we're going to take some time to prepare and get that podcast in order. But we really do hope to see you the next time, March 11th, on Thursday, March 11th from 3 to about 3:45 again. And again, we'll continue that until this public health emergency is over. But we do hope once we launch our podcast that you join us there. There was some questions here about entering into our clinical trial we're helping design. Email your candidates to FIRRIMupDoctors@gmail.com. That still needs to get through approval through an NIH, et cetera. And we're working on that. So we actually don't think we'll be enrolling and getting that going until the earliest late summer, and that'll probably launch towards the fall. But that's a really exciting project we're working on. And we know that there's a lot of people out there who are suffering with PACS, but even without the trial, Dr. Kathleen and I have been very successful in getting our patients functional again. So
Yeah.
Thank you for coming, Dr. Kathleen. Thank you all for being with us for a whole year. And Audrey, thank you for hosting this. For now, be safe, be well, and God bless you all.
Thank you. Thank you all. Ciao.
All right, everyone, I'm just going to quickly go through the supplement and the book offerings we have as per usual. So first, we have the FIRRIMup Doctors Basic Immune Pack. I know they briefly went over it today. So that top line is going to be your C-DAWS protocol, so your vitamin C. And then we have two options for your vitamin D. We have the one on the left that's going to be the standard, and the one on the right is the vegan liquid format. And then we have our Omega. So the one on the left is the Pro Omega 2000. That's going to be the standard one. And the one on the left is, or the right is the Algae Omega, and that's the vegan version. And then we have our Pure Encapsulations Zinc 30. So that's the C-DAWS. And then the plus is going to be that bottom row. So the Quercetin by Pure Encapsulations. We have the Colloidal Silver Spray, that's the nasal spray, and then the Neo 40 lozenges. And so this entire bundle can be found on the FIRRIMup Doctors Get Healthy store. If you just navigate to that link, all the bundles are right there at the top, and the blue ones are going to be your standard version, and the green ones will be the vegan version. And then next we have the FIRRIMup Doctors Post-Exposure Prophylaxis Bundle. So this is going to be the same foundation as that basic immune pack. The only thing we're adding is the immune PRP spray. And then for this bundle, the FIRRIMup Doctors do recommend, if you have been exposed to someone who was positive with COVID, that you go ahead and triple the doses that you would normally take with that basic immune pack. So all the skin supplements, just triple the dose and then adding that immune PRP spray as well. And that can also be found on the FIRRIMup Doctors Get Healthy store. And we have the standard version and the vegan vegetarian version as well. So now getting into the books, we have our Kick COVID-19 to the Curb book. And if you wanted the paperback version for $29.99, you can either get it at our FIRRIMup Doctors store online, or we have a few copies at our NFIM office. And then if you wanted the ebook version, you could get it on Amazon Kindle, Google Play, or Barnes & Noble for $9.99, or you could get it on Audible for $14.95. And then for Audible, if you don't have an account yet, you can do a free trial, and then your first book will be free. So, and then also with that, as always, if you send us the proof of the receipt, we have our February special, so you'll get 20% off of the Ultra Potent Vitamin C and then the Zinc AG. And then next we have Dr. Akey's Fine Tune Your Hormone Symphony book. This book is at the FIRRIMupDoctors.com website, and then we also have it on audible.com. And this is a great book to learn more about your hormones and your overall health and well-being. And then lastly, we have the Fascia, Function, and Medical Applications textbook from Dr. Akey. And we do have a few paperback versions still left at the NFIM office. And so if you email nfimgmv@gmail.com, we can offer you curbside pickup for $55. And it's also available at our FIRRIMup Doctors website and amazon.com. And so that's all I have for you today. I just want to thank everyone so much for joining us through this whole COVID series journey. We've been given awesome information, great guidance from the FIRRIMup Doctors, and we're not going anywhere. We're going to be back March 11th and continuing with these COVID updates as long as the pandemic is still going on. And you can always connect with us on our social media through Facebook. We have Instagram. We have our FIRRIMupDoctors.com blog and our website there. And then while this is going on, we'll be working on a podcast and rolling that out with some great integrative health topics. So if you have any ideas for that, feel free to send them in. We'd love to hear you guys' opinions. So for now, be healthy, be safe, and we'll see you March 11th. Thank you, everyone.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements,
and resources discussed today, please visit us at www.FIRRIMup That's FIRRIM doctors.com. And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.